Welcome everyone. This video is on malignant otitis externa and it is made for the benefit of third year MBBS students who are going for their theory exam for NEET PG and next examination. So to begin with, what is malignant otitis externa? Malignant otitis externa is nothing but an inflammatory condition that is caused by the bacteria Pseudomonas. It is a very severe and dangerous infection, and its timely treatment and diagnosis is very important. So moving on, the etiology I already said, it is caused by the causative agent is Pseudomonas, and it is more common in elderly patients who have uncontrolled diabetes mellitus, and it is also seen in patients who are on immunosuppressants and who are having chemotherapy. So these are the predisposing factors for the development of malignant otitis externa. Then moving on, clinically, when you look at the clinical features, initially the patient will have symptoms very similar to diffuse otitis externa, that is pain, discharge, conductive hearing loss. Then later on it will progress into excruciating pain, and then you can see granulation tissues in the external auditory canal. Granulation tissue in external auditory canal is a characteristic finding, and you can see that on otoscopy. And there is also associated facial paralysis because there is involvement of the facial nerve. Then the thing about Pseudomonas infection is that it's very aggressive, like I said, and it easily spreads to the bone. Okay, so it can spread to the skull base and jugular foramen. And how does it spread to the skull base and jugular foramen? So as we all know, the external auditory canal, its cartilaginous part, it has fissures known as fissures of Santorini. So the infection can spread through these fissures into the skull base or to the jugular foramen, and this leads to the formation of multiple cranial nerve palsies. So the mortality rate of this infection is very high. So it's very important that this is diagnosed properly and treated. Then it can also spread anteriorly into the temporomandibular joint, and it can also spread posteriorly to the mastoid, into the middle ear, and into the petrous bone. Moving on, diagnosis and treatment. So when you diagnose, what do you do for diagnosis? You can first you have to see if there is if the bone has already been involved. So for that you can do technetium 99 bone scan, and this is a diagnostic investigation for bone infection. You can see if the bone is involved by doing this scan, but you cannot use it as a prognostic investigation. Why? Because once you give this patient technetium 99, the patient will remain positive for a year. So you can't really use that as a prognostic investigation because the patient will always show it as positive. Then as a prognostic investigation, what we use, so we can't use technetium 99. So what we use for prognostic investigation is gallium 67 ball scan. So this is taken up by monocytes and reticuloendothelial cells, and this investigation is repeated every 3 weeks to see the progress of the patient to the treatment. Now moving on, the treatment. So first, if the patient is having diabetes mellitus, you have to control it first. You give insulin or anti-diabetic drugs, whatever it is, and you control diabetes mellitus. Then what you do is you give ear toilet, you clean the ear. For that, you can you can do that, like you can remove the dead debris, the discharge, the dead tissue, the dead bone, etc. All that you have to remove. Then what you do is that you give antibiotics. You can give third generation cephalosporins like ceftriaxone or ceftazidime. You can also give fluoroquinolones like ciprofloxacin, ofloxacin, and levofloxacin. And you can also give gentamicin plus ticagrelin. What is ticagrelin? Ticagrelin is an anti-pseudomonal penicillin, right? So you can give a combination of that too, and that's how you can treat it with antibiotics. Thank you. That's all about malignant otitis externa.